High-tech help is making a big difference for women who are living longer after breast cancer. Here to explain how is medical reporter Liz Bonis. Liz?
Hi, Brad. It is a whole new way of treating breast cancer. Rather than just focusing on killing the cancer, experts at the Mary Jo Cropper Center for Breast Care at Bethesda North Hospital are now focusing on preventing one potentially deadly side effect for women who need radiation. They do it by treating cancer in the left breast differently than if it's in the right. The call came in right after what she thought was a routine mammogram.
I was at my mother's in Lexington, Kentucky.
And they said,
"You have cancer."
That cancer for Ginny Reynolds turned out to be on her left side. She was referred to this team of radiology experts because Dr. Jess Guarnaschelli says we now know
if we inadvertently treat the left breast with radiation for these left-sided breast cancer patients, we can cause cardiac injury 10, 20, 30 years down the line.
So to spare Ginny's heart, they trained her to do what's called a deep inspiration breath hold. She refers to it as
This little thing of doing yoga breathing while you're having radiation can make such a big difference. It's amazing.
What that does is it pushes the diaphragm down and thins out the heart such that when we deliver radiation to the left breast, we're able to avoid the heart.
Here's how this all works. As Dr. Peter Sandwell showed me on this image, when a patient holds their breath this way, it moves the chest wall away from the area that needs the radiation, so you miss the heart.
This is the heart in the center here. Over here is the lumpectomy.
Okay.
And this is the full expanded lungs. If they hadn't taken a deep breath, the chest wall and the heart would be almost touching.
To make that happen, a patient is hooked up to this machine. It shows you the peak place to breathe and hold. So to illustrate that, we're going to have a little breathing session. You guys are going to tell us to breathe in, and then we're going to see what happens on the graphic, and then breathe out. All right, ready?
Breathe in.
Okay, and here's the graphic that we go up to, and then
Breathe out.
So far, in follow-up visits for Ginny, her cancer is gone and her heart unharmed. So simple, makes such a difference. This, of course, part of a newer way of treating the whole person, not just the cancer, as women live longer after a diagnosis. Ginny could do all this, however, she reminds us, because her cancer was found early on a mammogram, and she faithfully got that mammogram every year.